Hello, and welcome to today's webinar, hosted by the Green Growth Knowledge Partnership and organized in collaboration with the United Nations Environment Program. I'm Ben Simmons, and I serve as the head of the GGKP Secretariat. We're very happy to have you with us today. This is the fourth webinar in our series on sustainability after COVID-19, and is focused on the challenge of COVID-19 medical waste and what countries can do to address this growing problem. Not surprisingly, there's been a great deal of interest in today's webinar, and we are fortunate to be joined by a distinguished panel of global experts from a range of international organizations. During the webinar, please feel free to make comments through the questions box. It's a great opportunity to engage directly with the experts. After the webinar today, please take a few minutes to complete our short survey. Your feedback is extremely valuable and helps us shape future webinars. I should also mention that a full recording of today's webinar will be available on our website at ggkp.org. Our next webinar in this series will take place next week at this same time, and will explore the implications the pandemic will have on gender equality and opportunities for promoting women's empowerment through the recovery efforts. It is now my great pleasure to introduce the moderator for today's event, Monica McDevitt. Monica is the chief of the UNEP Chemicals and Health Branch. Monica has a very long and distinguished career, and I encourage you to take a look at her full bio on our website. Monica, I am delighted to welcome you to today's webinar and hereby pass the virtual podium over to you.
Thanks very much, Ben, and I'm really pleased and honored to be able to moderate this session. So hello everyone, and welcome to today's panel discussion on the very highly topical issue of sustainability after COVID-19, the medical waste response. As Ben said, I'm Monica McDevitt, and I'm head of UN Environment Programs, Chemicals, and Health Work based here in Geneva. My team is leading UNEP's response on medical waste management from the environmental angle in partnership with the World Health Organization, the UN Development Program, Global Environment Facility, and a number of non-governmental organizations. I'll be your moderator today, as Ben said, and I very much look forward to hearing both from our panel of experts and from you. In discussing today's topic, we're going to cover four key areas: the design and effective COVID-19 waste management strategies and action plans, international support to developing countries on COVID-19 medical waste management, what are some of the hard take-home lessons we can act on to avoid a medical waste crisis in the future, and what are the real and safe opportunities for entrepreneurs and small businesses in sustainable medical waste management. These are big topics in themselves, so I do hope that we have time to address each of them and provide you with the locations you can go to find additional information and resource material. Underlying each of these key questions for today is embedded the notion of sustaining a medical waste management approach that is not a once-off response to a current crisis, but a stable, systematic, and maintained approach that works for communities, which takes on board and respects the unique character of communities worldwide. There may be the ideal solutions to strive for, but currently there is no one-size-fits-all approach. But we do have resources to help governments and communities do the best possible job of managing medical waste, including urgently needed guidance for the volumes and composition of medical waste being generated now due to the COVID-19 pandemic. We have an impressive panel today from both within the UN family and from international organizations to share with you some of the work they are doing directly related to medical waste management. We're fortunate indeed in the 21st century to have the technology and ability to undertake a collective effort, even with life under lockdown, as we're doing here today, and to work together as never before, focus on common problems and joint solutions from our respective mandates and missions. It's critical to communicate to our constituencies and stakeholders the advice and guidance that is based on years of science and research from many disciplines and sectors, so that medical waste can be safely handled to protect people and the environment on which we all depend. We've also been given the opportunity in this pandemic to achieve a level of ambition that may have remained largely on paper had we not been forced to face it head on at a moment's notice. We need meaningful and effective participation from all corners of science, management, governance, society, and business. So as we have become used to virtual presence and engagement, I look forward to your active participation in today's event. So let's get started. We have 5 experts with us today, so I'll give each of them a 5-minute opening remark opportunity, and then we'll move into those 4 question areas that I outlined at the beginning of my intervention. We do have technicians behind the scenes to help queue your questions and comments so that we can have as interactive as possible and engagement. So keep those questions and comments coming. So with that brief introduction, I'd like to give the floor over to Kate Medlicott from the World Health Organization to give us a brief introduction and to give us her remarks. Over to you, Kate.
Thank you, Monica. Okay, so thank you firstly for inviting me to be here. And I think the first thing I really wanted to say is that if we look what's happening with the response in general, the countries that are following science and evidence are the ones that tend to be doing best. So I wanted to start off with some of that around what's happening in health facilities in general and specifically on COVID from a health perspective. So the first thing that we need to think about is just remembering that the main transmission pathway for this disease is from respiratory droplets. The survival on surfaces is around, it's a bit unclear because we're learning all the time, but between 2 hours and 9 days, depending on things like the temperature, humidity, and other things. But it can be killed quite easily with disinfection in 1 minute using ethanol or hypochlorite or chlorine solution. There's been quite a few studies that have maybe caused some concern about COVID being carried in fecal matter. The important thing to know there is that what they're finding is just RNA fragments. It's not infectious COVID in feces. So we really need to focus on transmission from respiratory droplets and surfaces as the main transmission pathway. The really important thing to remember is that all of our existing advice on healthcare waste management holds. So, things around regular cleaning, PPE, waste segregation, all of these things are still relevant for COVID. The other thing I wanted to remind us of is just, the situation that so many of our health facilities are in. I mean, they're really, it's quite an urgent and desperate situation, you could say. 1 in 4 health facilities lacks basic water, 1 in 5 has no sanitation service, 42% have no hand hygiene facilities at the point of care, and 40% don't even have like a basic system for waste segregation. So I think what we really need to be focusing on is taking the opportunity, if you could call it that, of the COVID epidemic to really accelerate what we know already needs to be done. So I'll leave it for there now.
Great, thanks very much for that, Kate. Appreciate your opening remarks, and we'll get to the questions. So I want to turn now to Rolf Payet. Rolf is the Executive Secretary of the Basel, Rotterdam, and Stockholm Conventions, affectionately known as the BRS, and former Minister of Environment and Energy of the Seychelles. So Rolf, with that, over to you for your intervention. Rolf, we're not hearing you. Can I ask you to just unmute yourself there?
Yes, hello, good afternoon, everyone. Okay, I haven't got COVID-19, I've just got allergies, and it seems the pollen around the last few days been driving me crazy. So I hope you can hear me very well. As you know, with regards to the pandemic, there's a lot of issues around waste that we need to look at. Yes, we've heard from my colleague from WHO talking about the resilience of the virus and how we can live up to from several hours to 9 days. But there's a lot of other issues around the issue of the pandemic that we need to reflect on, and this is of course related to the human consumer response. And if you do a quick, I did a quick Google, because the information is not really based upon research, but it's very clear that the demand for hygienic and medical goods have gone up, and in some cases up to 300%. And more goods means more waste, because people use those goods and then they generate the waste out of this. Long shelf life goods as well in the shops have gone up also by 200 to 300%. which means that these foods are now being stored in case there's a lockdown or during the lockdown, and then people will just discard it after that. So there will be more packaging waste and also food waste as a result of this. There's a lot of people who have moved to buying online stuff, so that's also a significant increase. And of course, when you buy online, then there's more packaging waste. And when people unpack all these foods, then they throw it into the waste receptacles or otherwise. And of course, there's been a lot of online ordering now. Now that's the big thing following the confinement. Even here in Europe, a lot of people are ordering food from restaurants online, and this comes with a lot of packaging waste. And of course, retail has gone up by 150%, where packaging waste have also increased. Now, in terms of medical waste, there's increases from existing medical facilities. There's also been the setting up in several countries of temporary medical facilities because they run out of beds in the normal hospitals. And these facilities, these temporary facilities, of course, don't have proper chain of custody for dealing with medical waste unless there's a system in place. And as you would expect, in many countries where waste is not seen as this priority, then those wastes can be disposed of in an irresponsible manner. There are some reports from some countries that they've seen increases in waste from 15 to 20%. But of course, as I said before, we don't have quantitative data at this stage. And these are just estimates and observations that we've seen from different countries. Overall, there's been uninterrupted waste management in many of the developed countries, but in many developing countries, there's been interruptions in waste management, and of course, which leading to accumulation of waste in different parts of those countries. There's also been interruptions in recycling, which of course this is an important aspect of waste management. And I've only seen a couple of countries now, or counties or states, who are starting normal recycling again following the confinement. So there is these impacts on even the services that is in place for management of wastes. On the issue of final waste disposal options, there's a lot of discussions currently on the final waste disposal options, but obviously for countries that have got incinerators, I mean, much of the medical waste are going to either specialized incinerators or normal municipal incinerators. Other countries are landfilling, some are stockpiling, and some are even looking at burial, and some are even looking at open burning, although that is not recommended because of the consequential health impacts as a result of burning of plastics and everything. But at the end of the day, each country have to deal with waste depending upon what systems they have in place at this stage. But I just wanted to say before I end that this is an opportunity. It is a great opportunity that we have as people dealing with waste, municipalities, and everybody to relook and to improve waste collection as a result of not only of COVID, but also as a result of human consumption and maintaining health levels in cities and in villages and all around us, because there's very, very strong links, as you know, not only within COVID, but other kinds of vector organisms such as mosquitoes, mosquito vector-borne diseases arising from mosquitoes and rats, for example, because if you leave waste unattended, then there are receptacles for mosquitoes, especially in tropical countries. And of course, then let's not forget the plagues we've had from rats as a result of poor waste management. So there is a case for us to focus on waste. There is a case. I know politically many countries are responding to the health and well-being of the people, but at the end of the day, we should not forget the importance of dealing with the issue of waste, as it can lead to further health issues and, of course, environmental impacts. I will stop here. Thank you.
Great, thanks very much for those comments, Rolf. Much appreciated. And I think it's generated a lot of questions. I've been watching the chat box go by, so hang in there, we'll get to your questions. Now I'd like to just turn to Mr. Frank Pinto. Frank is a senior consultant on chemicals and energy efficiency, the director of the Montreal Protocol and Chemicals team at the United Nations Development Program. So Frank, over to you for some introductory comments.
Thank you very much, Monica. It's a pleasure for me to have been invited to speak at this webinar. Let me start with a few general observations since I've been sort of compiling lessons from the past. There have been 3 previous pandemics which had higher mortality rates but fewer infections than what we have now. The 2003 SARS pandemic, the MERS 2012 pandemic, and then the 2014 to 2016 Ebola outbreak. It's only the 2009 to 2010 swine flu pandemic, which originated in the US and which had 274,000 hospitalizations and almost 12,500 deaths. That basically was the major pandemic in the last few decades. In contrast, COVID-19, as of yesterday, had 4.9 million cases globally and 320,000 deaths. And this is all within the last 6 months. Experts are forecasting that we may have many more months left to go, including potential second waves. So it has the potential to be the most serious type of pandemic the world has seen since the Spanish influenza of almost 100 years ago. Many of you may know the United Nations Development Program. I'm right now a consultant there, as working on development and environment issues, but it also works together with partners on health issues for the last 2 decades. It has a presence in almost all developing countries and at present assists 84 developing countries handle the environmental, health, and developmental aspects of health issues, taking into account gender issues and the achievement of the Sustainable Development Goals. This has involved helping countries transition to sustainably use, dispose, and destroy of POPs, persistent organic pollutants, working with WHO, the private sector, and NGOs like Healthcare Without Harm. UNDP has safely disposed of more than 18,000 tons of POPs and helping the health of 2.5 million people. The GF is also the funding mechanism for one of the funding mechanisms for the Stockholm Convention. The GF is also a funding mechanism for the Minamata Convention and Mercury. As many of you know, the Mercury is involved in many medical devices, industrial processes, and small-scale gold mining. The idea of getting rid of mercury is to prevent this mercury from entering into water bodies, where it can then enter into the food stream. The fish ingest the mercury, we eat the fish, and it enters into our food chain. UNDP is also assisting 42 countries in this regard. Thank you.
Great, thank you very much for that. Appreciate your comments and setting the stage for us on those issues. We now would like to turn over to Donovan Story. Donovan is the Deputy Director of Urban Lead and Green Cities at the Global Green Growth Institute. So Frank, if you could turn off your camera, thank you, and we'll give the stage to Donovan. Over to you for some introductory remarks.
Thank you. Well, I think that, and good evening and good morning and midday, everyone out there. I think that just building on the comments, but not repeating the comments of the previous speakers, I think that the crisis has really reiterated the centrality and critical importance of effective, safe, and efficient waste management services. And I think what it's really done is highlighted a greater concern and debate over healthy cities and communities and the role of waste management services in meeting those expectations. So I think if there's something which could be seen as a positive outcome from the current pandemic, it is that we've returned to some of the basic principles of healthy cities and healthy systems. And we're starting to look again now, I think, at what effective door-to-door sanitation and waste management services look like. We're seeing their importance now in the debate of clean and healthy cities and environments. And we've been able to now, I think, maybe look at potential future and further investments in waste management services. I think, though, that clearly that the pandemic has made the existing solid waste management system much more complex. The systems are much more complex. The waste is becoming more complex. I think, of course, more dangerous. And here, of course, just returning to the earlier point that, you know, there is a lot of science still to be done on terms of contamination of surfaces and the period of time of that contamination and so on, which is, I think, has created a source of concern, particularly from waste management workers over the handling of what may otherwise be quite safe forms of solid waste. But because the science is largely out on the lifespan of viruses on different surfaces, there's an attitude that all waste is potentially dangerous. And of course, it's exposed the vulnerability of workers in the waste management system, something I'll talk about a little bit more later on. And here, you know, there is obviously an exposure of health threats to formal sector workers, but certainly in developing and middle income countries where the informal sector can sometimes play a much more dominant role in waste management services, already in quite a dangerous and vulnerable way. It's increased that vulnerability. And these workers are often outside of formal systems, of protocols. They lack the materials to safely handle waste at the best of times. So it's increased their vulnerability greatly. And I think that's a very important issue to raise. And hopefully it brings informal sector workers more into the mainstream debate over waste management systems. I think that therefore the current pandemic has really exposed systems of labor intensive and informal systems, and it's also exposed the vulnerability of cities and communities which lack sanitary facilities. I think it's also exposed in many ways the lack of source separation and effective source separation of materials. It's created new forms of waste, which, because of a lack of source separation and facilities to keep materials separated, has created a mixed volume of waste, which is now seen as fully contaminated. We know that in the waste management system that once you contaminate one part, you potentially contaminate all. So in other words, it's really dislocated the circular economy that we've been working so hard to support for a number of years, because essentially once contaminants enter that system, then there's a sense that all materials are potentially contaminated and toxic. I think also it's, as was raised earlier on by Rolf as well, there's been a resurgence of problematic forms of waste for our ecosystems, particularly in plastics, which is now seen as kind of the clean alternative, the hygienic alternative. So we've seen a resurgence in the use of plastics and packaging under the umbrella of health, including you know, advice to consumers to double bag materials and so on. So I also have a great concern about more and more of these materials entering the ecosystems. That's existing forms of plastics, but now we have, as we've seen through some really interesting photographic exhibitions recently, new forms of unrecyclable materials that are too small to recycle, don't have a secondary value, particularly face masks, and particularly plastic gloves that have been used for all sorts of purposes, which have been disposed of out on the streets and are entering into our ecosystems, particularly river systems. And finally, the final point I'd like to raise, which I hope we go back to through the seminar, is that it's taken the, if you like, the medical waste stream, and I'm not an expert on medical waste, so I'm coming at it from a waste management perspective and expertise. It's taken the medical waste, which is previously seen as being kind of outside of the municipal solid waste stream, and it's brought it into the mainstream system. It's brought it into the household, if you like. And I think that this is a potential challenge, and it's an important challenge for us all, because, you know, now all household waste is potentially, particularly through lockdowns, has seen as potentially medical or treated as medical forms of waste or contaminated forms of waste, in which we don't really have the facilities and capacities to deal with. And so that's overwhelming a lot of cities that are taking solid waste, essentially solid waste which may not be contaminated or what may not be contagious, but treating it the same as medical waste. But in systems and in cities where there is a very limited capacity to deal with medical waste at the best of times, and now they're having to deal with the totality of volume. So those are the points that I'd like to raise, and we might go back to them in more depth later on. Thank you.
Great, thanks very much for that, Donovan. And I think your comments have raised quite a few opportunities for people to ask questions and to intervene and to make some comments. I've seen a very active chat box off to the side there. Before we get to that, I want to turn to our final panelist, and that's Ruth Stringer. Ruth is the International Science and Policy Coordinator of Healthcare Without Harm. So Ruth, over to you.
Sorry, just trying to bring up my my camera. Hello, everybody. I hope you can hear me. I hope you can see me fine. Thank you very much for having me here today. And as a medical waste specialist, I'm delighted that we're having this really important discussion. I think Donovan has raised a lot of very important points. But if I've got one message here on medical waste management, it is that we mustn't overreact and we mustn't panic about this. The systems that we need to deal with COVID are exactly the same systems that we needed last year. And so if we have a system that is operating well, what's needed now is to support it and to make sure that the people are properly cared for, so that we're not having people in fear of handling waste that they were happy to handle last week. So we need to make sure that the human side, which is probably 80% of the system, is supported and not just worrying too much about the technology. We need to be strengthening the systems that we have, but being aware that now that we're in the middle of the crisis, that there are certain things that are not going to be possible. If the house is on fire and someone has organized a bucket chain to bring water in to put it out, we don't go and say, now you need to do this differently. Don't go to the river for the water, go to the well. We need to support them and give them more buckets. And we don't say at this stage, okay, the house is on fire, but we need to install a sprinkler system, because that isn't going to work. So my overall, and I'm going to have lots more to say about exactly what's appropriate technologies in different places and the ways in which the international community can support and facilitate that. But the main thing that we need to be aware of now is to keep the systems that we have going as smoothly as possible, and to make sure that the interventions that we make are appropriate for the context, that they are supporting rather than disrupting, and that they're also interventions that in a year from now that we will be glad that we've made, and that we haven't changed procedures or introduced inappropriate technology or done things that, in a year from now, we wish that we hadn't done. We haven't dropped our standards. So with that, I think I'll leave it for now, and let's go on to the broader discussion.
Great, thanks very much for that. I think everyone's made some fantastic opening remarks, and they've created a really good space for people to ask questions. And I see that it's been very rich in terms of the comments and some of the suggestions that are coming from members of the audience. So what I want to do now is get us onto some of our topics that we're going to discuss, that we've set out to frame our discussion around. And the first of those questions, and we're going to try and capture a lot of the feedback and the comments in sort of 15-minute sound bites, because we have 4 questions and 15 minutes per question will take us an hour to get through. But I see that there are some questions and some comments that are coming up that may not necessarily fit perfectly into each and every one of these 4 areas. So what I'll do is I'll look at creating a question, a general question that captures some of those comments, and then just ask members of the panel directly. So if we start from the beginning on 4 questions, we posed the question to the panel: the design of effective COVID-19 waste management strategies and action plans. And so there were a number of questions related to that I came across, and I'm sure that the panel members were able to see that as well. And a lot of these had to do with how do you handle waste. Now, those are very detailed, I think, and very specific questions that are being asked, but such things as what Mahesh was asking from Nepal, if you don't have an autoclave, could you dip COVID-19 waste into hot water, and if so, for how long? What are the kind of things you can do? Ian was asking if the public is buying personal protective equipment and not knowing how to properly dispose of it, can we address that? So I think what I might do is ask Donovan perhaps to take a first stab at this, and then perhaps we can go on and hear some remarks from Ruth, who is an expert in this area. So between Donovan and Ruth, can you address some of these questions and some of the strategies and actions for effective waste management?
Absolutely. Donovan, are you going first?
Thanks, Ruth.
I can.
No, it's okay. I mean, I'll let you answer it in bulk. My main concern, if I look, I'm a member of the International Solid Waste Association, and they very regularly update country strategies in terms of what they're doing. And I think one of the things that's really clear from that is that the response from country and city level has been very scattered and very diverse. And I think if we go back to the point of Ruth, I think it's very important that we develop from this some global practices and some protocols based upon the experience of countries, but which can also inform countries and guide countries, and having a set of clear guidelines and strategies which take the fear, if you like, or the lack of information out of the picture, and which allow countries to more confidently and clearly deal with you know, the changing nature of waste, changing volume of waste, the composition of waste in a more confident fashion without completely disrupting their solid waste management systems or putting in place you know, expensive and unnecessary practices which can't be sustained over the longer term, particularly if the pandemic takes some time to get control of. So I think it's very important that we don't act in isolation from one another, that there is some sort of coordinated set of guidelines which is clearly articulated, and obviously WHO is in a very good place to be able to do that, and it has set out some guidelines in April, which I think have been very important and effective for country teams, for countries. And I think that, you know, we need to do a lot more learning from the practices of countries of what have been more effective strategies, and to be able to build protocols around there. And I think what's also very important in terms of developing these strategies is that they're very holistic, and they encompass countries at various levels of development, and they really don't just speak to formal systems or European or North American or Australasian systems, but they're systems and strategies which are able to speak to very different waste management systems, which don't rely on necessarily high levels of technology, the anticipation of having incineration or formal collection systems, and so on. So we develop protocols which are also, and guidelines which are also very flexible for countries at various levels of development. Thank you.
Okay, thanks, Dora. To follow up on that, I'm going to address the specific questions. So Mahesh in Nepal asked, if you don't have an autoclave, should you be dipping the waste into hot water, and if so, for how long? The answer is no, don't do that. You're going to end up with it. It won't be effective. Even if it were to be able to deal with the COVID or the SARS-CoV-2, to give it the correct name, then it's not going to deal with the other pathogens that are there. And so even though we're dealing with COVID waste, we mustn't forget the other pathogens. So if you do not have the capacity to use a steam disinfection method, also don't install incineration. That is something against the Basel, Stockholm and Rotterdam conventions, the BRS. So like I said, don't do something that you wouldn't want to do next year. My recommendation would be to landfill, and that can be done securely. All you need to have is a certain fenced area to make sure that the waste is covered over immediately that it's deposited. Donovan, you mentioned the International Solid Waste Association. I'm also a member of the International Solid Waste Association's Healthcare Waste Working Group. And we've also got, there's also an informal group of international agencies. Healthcare Without Harm is then coordinating with WHO, UNDP, UNEP, Stop TB, Gavi, UNICEF, UNIDO. I'm sure I've missed people out, but we do have good coordination on this. And so the messages that I'm trying to give now are also the ones that align with the WHO guidelines and so on. Then to turn to the second specific question, what do we do about disposal of this medical waste that is being generated in the community? And our recommendation is that this is not classified as infectious waste, that it may, you maintain keeping it as ordinary general waste. You collect it in the same way. You need to protect your workers in the same way that you would from the hazards that they experience from general municipal waste every day of the year. And I think that every day of the year the people are probably underprotected, and so we should be strengthening existing systems and existing protections for the waste workers. The only thing, and the thing I would urge extra caution about, though, is when there are things like masks and gloves that are being disposed of, you may get illicit recycling. We see this in hospitals and or places where there isn't healthcare waste management properly, because syringes can be quite valuable because the unscrupulous suppliers will rinse them out, repackage them and sell them. And we're seeing that now with masks. So as an individual, if you are using a surgical mask or any sort of face a disposable face covering, then take a pair of scissors and cut it before you put it in the bin, and then wash your hands. So make sure that stuff cannot be used again. Other than that, we should just treat it as ordinary municipal waste.
Great, thanks very much for that, Ruth and Donovan. And I think there's probably a number of other questions on there, but I'd like to turn to Kate, because I've been sort of tracking a few of these questions and people asking about, particularly at the home level, how do you deal, and we have started to touch on some of the home level of how you dispose of waste and how you deal with it, and the infectivity of waste and that kind of thing. So do you want to perhaps expand on that a little bit and help us to understand a little bit more about how we deal with people direct contact and home related waste?
Sure, I'd be happy to. And I just would also like to point out, I see Ute Piper, who's one of our lead experts on healthcare waste, is busy in the chat box, so she can fill in the gaps where I may be missing some. But just to say, the existing advice we have on home waste is, as Ruth said, is it should be not treated as infectious waste, but tissues and masks should be bagged up and put out with the normal municipal solid waste. And that the use of masks is recommended for carers, but otherwise the cloth face coverings are for others in the community is what's recommended. I just wanted to sort of go back a little bit though on some of the other comments around information, because I think this is absolutely key. When we look at some of these waste management services from home and in health facilities, they're quite precarious at the best of times, as some have mentioned, and some of these fears from workers or potential that waste volumes might go up because things are misclassified as infectious, or staff not being willing or confident to come to work, especially when in some cases staff numbers are just down anyway, because this tends to be sort of informal and migrant labour. These are all really sort of precarious services in many places. So I think really making sure that we're providing solid information, that we're busting myths where necessary is really important. And picking up on this point about context-specific solutions, so really starting with an assessment of what's happening in a city or a health facility and building on those existing systems. Yeah, so I've strayed a little bit away from the home environment, but it's just to say that yes, especially looking for reusable materials where we can, and ones that can be washed and or as Ruth said, can be made sure that they're not recycled into an unsafe secondary market.
Right, no, thanks for that. I think there's quite a few questions that are coming up with some very specific and individual scenarios and cases, like what do I do if and that. I think we've provided a lot of general guidance on how to deal with personal and household waste. One more sort of line of thinking around this particular topic. There have been a number of people who have raised the question of, is this a call to action for reducing the amount of, say, plastic packaging that a lot of this waste comes in, separation of the waste? How do we deal with reducing the amount of plastic that we're dependent on, and how do we look at recyclability? So if we could spend just a couple of minutes on that, perhaps Frank from UNDP side can give us a few comments around just the sort of circularity of the plastic economy in some ways, and how we should be looking at that or taking this as an opportunity.
A lot of the single-use plastics that people have been using in the past, in general, have ended up in the oceans. We now have a massive pollution problem in the oceans because of that. One of the things that could be done, for instance, is instead of having disposable PPE, personal protective equipment, having it designed as in a more durable fashion so that it can be disinfected, say with hydrogen peroxide or some other types of processes, reused multiple times, at least 3 to 5 times, maybe 10. Face masks can also be, there are technologies available for disinfection now. Face masks, small scale, medium scale, and I think Battelle has now started very large scale, 20,000 face masks in one container. It's been tried out in Massachusetts last month, and it seems to be working fine. And this, if you can start recycling and making sure that users, doctors, nurses, and others are comfortable that the disinfection process is safe enough and it's not preventing them from, it will protect them from COVID-19. I think this could be an exceedingly good way of reducing plastic waste going into the oceans. And I think this is a way for the future.
Great, thanks very much for that, Frank. Donovan, do you want to perhaps add to that from a circularity point of view? You talked a lot in your introductory remarks around the whole issue of the plastic economy in many ways.
Yeah, sure. There's a few things. I mean, those comments today are spot on. There's a couple of additional comments though. One is that we're seeing things without a great recyclable value being created. You know, I live in Seoul, and when you go into a lot of bakeries now, instead of having the tongs and the board to get your bread, which is already a bit too much, but instead of having that, then you're immediately handed plastic gloves, right? And these are immediately thrown in a bin. None of these things have a great, well, they don't have an intrinsic value. They will simply be disposed of. And my concern is that there's a lot of itsy bitsy plastic forms of waste without a recyclable value, which are being created in the name of cleanliness, which I think a lot of it, again, it's a sense, it's part a degree of the unknown, and so we better be careful. And part of it is driven, I think, by meeting people's, fears, or addressing people's fears, where they think that if you put on these plastic gloves, then everything's fine, and I'm happy to enter that shop. That's one part of it, and we're seeing, particularly with households in lockdown scenarios, a great dependence upon food deliveries and packaging that's arriving, and the significant growth of clear wrap plastics and other packaging plastics, again, without much of a recyclable value. So these things, as Frank was saying, are entering into our ecosystems a lot, and we see a lot of disposed gloves and face masks being left outside and what have you. Some people sometimes don't want to bring them into their household or what have you, or they need to wear them in shops, and then they just literally throw them out immediately after exiting. And another challenge that we have, though, is because the price of oil has become so low, suddenly plastic is becoming essentially extremely competitive and essentially free. And I raised the case in an earlier webinar in Thailand, where one of the countries that's moved towards the ban on single-use plastics and a taxation on plastics has now taken away those restrictions to meet people's expectations of wanting to have more plastic. And the plastics industry that was starting to become very uncompetitive and closed down is now coming back with a resurgence. And those companies that were developing eco bags and different forms of organic-based bags are struggling to compete because essentially the fuel that's being used to make plastics is essentially free. And likewise, RDF from plastics back into fuel is becoming uneconomic. So I do worry that something that we've been working on for a lot of time in terms of household behaviors around recycling, around circular economy, and building those businesses, which we know are quite fragile. For all the efforts we put into a circular economy globally, still only about 12 to 15% of materials are recycled. It's a hard enough battle as it is, and now we're seeing the flood of a lot of small itsy-bitsy materials, but also the rise of these old forms of waste which aren't being effectively processed. And the final point on that is we've seen a real disruption to the circular economy. Waste pickers and businesses haven't been able to freely move around cities and localities to collect waste. So we see a mixture of that. We've seen even in relatively wealthy countries like Australia and New Zealand, complete breakdown of recycling systems, and even the call for households not to worry about recycling at the moment for the time being, just throw it all into a bag, which I think diminishes the behaviours that we've been trying to see. So I think that this is a challenge we're really going to have to face in the waste management community, is to get back on track for a circular economy. And as Ruth said, we have to do it now, not wait until the pandemic reaches a certain point or what have you. But we have to really start sending out those messages and supporting those circular economies now, so those gains are not lost.
No, great. Thanks for that, Donovan. And I think we've had quite a robust discussion on this particular question, and it's kind of spilled over into some of the other topic areas that we wanted to discuss. And we've had a very active participation on the chat box. So thank you, everyone out there. And I can see that you're starting to chat to each other and giving each other some advice and adding links in there and pointing people to resources that you can go to for very specific questions, like from Ian in the UK, can you use chlorine solutions to dip things in? So we've given a lot of, I think, very specific advice, and there's lots of resources out there, but we need to move on to the next suite of questions, and these are more around some of the things we've started to touch on, the support to developing countries on COVID-19 medical waste management. There have been a lot of questions and comments coming particularly from some of our participants who are asking from Benin, from Nigeria, from Nepal, asking for advice and where to go. And I'm going to start with Rolf, because at the sort of higher level, we need to help many countries around the world with some of their policy frameworks to enable those kinds of activities and strategies and action plans to take root and to be developed. And also, what the international community is doing to help from the policy environment. And I think you, as the executive secretary of the Basel, Rotterdam, and Stockholm, that's the policy framework that some of this could fall under. So perhaps you can give us a policy perspective and how we're supporting developing countries from a policy perspective on waste in particular.
Thank you, Monica. Before I get to that, I've been also following the interesting debates there. I just wanted to maybe discuss a little bit what we've been saying. I mean, there's been a lot of questions about whether household waste is classified as hazardous. Of course it's not, but if we put hazardous stuff in there, then it will become hazardous. So it is not really a definition that we can argue about for ad infinitum. But the situation today is that because of poor education in some regions of the world, poor management, everything goes into the waste bin, which makes that the household waste becomes hazardous. And I think as it's been said before, there are other pathogens, not only COVID virus. So if we're going to put things in the waste and say it's going to be all okay, I think we're sending the the wrong signal here. I don't want to create panic, but I think the correct information and the responsible information is to increase education, in the home, is to increase people awareness of how they can sort their waste. Now, many countries have recycling systems in place. I know some countries don't have it, but where those countries there's recycling, still there are challenges, and you will talk to many recycling companies, they still get challenges on getting people to sort out their waste, to deal with their waste in a very intelligent way. So I think we need to tackle with this problem, which of course then comes to the question whether household waste is hazardous or not, or whether what to do with the waste, especially if we have several families, people in a family who have been infected with COVID or have other kind of infectious diseases. How do we deal with these kinds of waste? And as you know, some countries have even come out with the regulations and guidance on how to package the waste in whatever plastic bag so it can be used, because of this lack of, I think, awareness, but also of this lack of knowledge on the issue. Now, coming back to your question on the global framework, I think, as Ruda said, the situation before COVID and now in terms of waste management is probably the same, and the situation is not really great. It's not really hopeful. Yes, many countries have got advanced waste management systems, but the majority of countries have got very poor, and some don't even have waste management systems. And I won't mention any countries here where waste is put on the roadside, close to households, and people living in waste. And I've just heard of a recent report that people, actually kids, women, everybody are going onto the waste dump, because now there's a price for masks. There's a price, as said by someone, for syringes, where they are picking them up and then reselling it back on the recycling market. So political commitment is very important, and at the end of the day, the governments also have to put a lot of emphasis on facilitating investments, putting in the right regulations and systems. And I think we should think of, and solid waste is very much that way, although sometimes we get sidelined discussing about solutions, or one solution, whether incineration, landfilling, and whatnot, but we don't think of systems. And I've seen many countries who've looked at solutions and then put in a nice incinerator or a nice landfill, but there's no one trained to run it, there's no one trained to manage it, there's no one trained, there's no waste collection system in place. All this is I think, a reflection of a chronic lack of political attention given to the actual management of waste, which then we've been looking at one solution or technology rather than at the whole system. And education and awareness, I come back to this again. I think if you look at the experience in many developed countries, it's taken many years, sometimes decades, to transform cultures into a culture of being less wasteful, but also recycling of waste, being aware of what type of waste goes where. And we've seen that recently, in dealing with the management of plastic waste, that by sorting and by proper management of plastic waste, we can actually help the recycling industry make it more viable, make it more economically viable in many parts of the world. So that brings me then to the final point on addressing medical waste capacity. Now, how many hospitals around the world have a proper medical waste system in place? How is that managed? How do they ensure that the person collecting the medical waste is actually disposing this medical waste in an environmentally sound manner? I mean, I know of a case, and I will not cite the country, where the container turned up in that country, and that container had body parts as medical waste from another country being transported transboundary across borders. So within borders, what's happening? How are people managing? Are hospitals just giving it to municipal waste contractors or any contractor to manage the waste? And where is the waste being disposed of? I think the situation I'm not sending up panic waves, but we have to treat the situation as it is now and as it was before COVID, and really call for international, but also national political commitment to deal with the issue of waste. I will stop here for now.
No, thank you very much for that, Rolf. And you've raised a number of really important points. And I think while we're on the topic of policy frameworks and that. Let me turn to both Frank and to Kate, coming from UN entities, and we deal at that sort of science to policy interface. There's a lot of questions that are coming up that lead into the research and how do you support and fund research? How do you look at providing the best policy advice so that governments can in fact put in place those good frameworks and move in the kind of directions that we're aiming them for. So Frank, from UNDP side, since you work so much at the country level, I'll let you go first, and then Kate from your side, from WHO, on the more sort of health aspects that seem to be coming out, and what are the kind of needs for policy advice to particularly developing countries who don't have the kinds of advanced technologies that, say, we do have here in Switzerland, for example. So Frank, over to you, and then I'll go to Kate.
Thank you, Monica. Rolf has mentioned some very valid points, but there is some good news. The good news is that the UNDP WHO Healthcare Without Harm partnership has been working since 2008, helping sub-Saharan Africa, helping other countries, mainly in Africa, build up their healthcare medical waste systems, including training, including using non-incineration technologies, autoclaves, etc. This turned out to be very useful because when the first project, which was started in 2008, ended in 2014, this was the time the Ebola crisis started. And we were able to use that, the three agencies were able to build on that to help countries, because a lot of the work which had been done before, that countries were completely, Liberia, Guinea, and Sierra Leone were completely overwhelmed with the Ebola crisis. We started to see open burning. We started to see several of these things under pressure. And basically, a new project was approved under the GEF, where the three partners again were helping these three countries cope with the Ebola crisis and further building up those capacities. Capacities have also been built up in Ghana, Madagascar, Tanzania, and Zambia. And further, UNDP has also assisted Ecuador, Egypt, Kazakhstan, Kenya, Kyrgyzstan, Jordan, Lebanon, and Vietnam. So basically, countries have been assisted in building up these healthcare waste management capacities. As Ruth had very correctly pointed out, you don't have to build this up from scratch. Things already exist. One has to build on what the countries already have. Training, as Rolf mentioned, training is absolutely critical because you have high turnover in many of the countries. And if you don't keep on doing the training, you lose those particular benefits.
No, thanks very much for that, Frank. And Kate, I'll turn over to you now. And I see there's a lot of chit-chat going on in the chat box, as we would expect. And I hope you've been following it as well, because a lot of people are providing information, links, and advice on things. But I'll hand over to you now, because there is still a lot of concern around how to deal with the reusability of personal protective equipment and things like that. What is WHO's perspective on that?
Actually, if you don't mind, I just wanted to go back to this your earlier question on the international community, because I think it's really, really critical. We're all here as waste management people or in the wash sector, and this is our bread and butter, but we need to remember that the health sector response to this, they don't really think about wash and waste much at all. And when you look at the big movements of money and momentum around that response, we really have to try and make ourselves visible in that. And because yeah, it is sort of so often forgotten. Even when you look at, like, there's been so much energy going into making heroes of doctors and nurses, they should also be, you know, the cleaners and the waste management experts should also be part of that sort of heroic effort. And I think that's really part of our job as international community, to do that in this kind of public communications way, which is really important, but also in our direct interactions with our colleagues in the health sector, and making sure that, I mean, this should be so obvious, but unfortunately it's not. If they're making big investments in PPE, then they need to include in that investment what they're going to do with the waste associated with it. You know, to just be procuring things without building in the waste management plan as part of that, I think is something we need to keep drilling home to our health colleagues, which isn't necessarily to say that we expect the health sector to deal with all of these things personally. Some things are very much health sector responsibilities, some are broader, but we do need to make sure it's included in the discussion. And as you say, doing these things like building on existing projects, making sure we're providing really solid technical advice, and there's been links in the chat box here to new treatment guidance, for example, that's just come out. And with this eye to always working on system strengthening, building on existing advice. And I think, as Frank mentioned, again, you don't really want to frame something like Ebola as an opportunity, but it did really galvanize partnerships around waste management. And I think there's another opportunity we have here now to build on that, not reinvent the wheel, but really use it as a mechanism to boost those partnerships and the visibility within national health frameworks.
Great, thanks for that, Kate. I'm going to turn back to Rolf for this. I think perhaps one last round of comments around the policy side of things and regulations and the use of unregulated, perhaps chemicals as a way to deal with waste and that. So, Rolf, can you perhaps give us some sense of the types of policy environments and regulation and monitoring of implementation that could be recommended to some of the people who are out there listening and asking these questions, and perhaps make a comment or two on what can be done to deal with unregulated chemicals in the environment that are being used in this particular pandemic.
Okay, thanks, Monica. I think we need to keep the focus on waste management. There needs to, governments are now dealing with the health crisis, with the pandemic crisis, but the focus on waste management needs to be kept. And the resources being allocated to waste management needs to be made available by governments or municipalities or whatever sector you are in. And of course, the role of the private sector. How do we engage? And this is for me very fundamental, because we've seen very, very solid models of where the private sector is involved in waste management, and not only in municipal waste management, but also in medical waste management and also plastic waste management. And I think the policy discussions on this needs to continue. The government needs to look at incentives. The private sector needs to continue innovating. And of course, when I talk about the private sector, I'm not talking about only the ones dealing with waste, but also upstream, where we are doing design. For example, some of the medical or PPE equipment that we are doing now, I'm sure there can be design innovations to make them recyclable or having them easily disposed of. You know what I'm talking about. So completing kind of the circular economy around the medical products and medical and hygiene or health and safety products. I think this is a big area, and I think this is what I was talking at the beginning, is this opportunity that it creates here for us to look at this from that perspective. In terms of international organizations, we need to continue working together. I think Frank has highlighted a number of areas where they've gained a lot of experience in West Africa. That space there needs to continue. That working with communities and governments needs to continue. We need to engage other partners. I've talked about awareness and education, UNESCO, other organizations need to be involved. And of course, grassroots organizations are very, very important. Today, in many developing countries, many grassroots organizations are involved in waste management, recycling, plastic management, and they will probably be also facing management of medical waste, because as I said before, the statistics show that medical waste has indeed increased because this is a global pandemic and a lot more people are being infected at the same time. So there is an issue there to deal with medical waste. So putting all this together, and I think also the issue of investment, I don't see the only role of the GEF, the Global Environment Facility, but also private sector investment and other forms of investment should come in to address this issue of medical waste as well. Let me see what I've put in all the points I had raised here. And at the end of the day, it is important that to note that managing and treating medical waste is expensive, can be expensive, and we need to work at making how this waste can become much more viable from an economic perspective as well, with the actors working together. And coming in from the convention's perspective, as you know, the Basel Convention regulates and manages the transboundary movement of waste. Earlier this week, Portugal, who is one of the cheapest countries in the EU for management of waste, has said it will stop importing waste from the EU because it has its own challenges of managing waste now with COVID. So, and many countries, as you know, as a result of the plastics amendments, have also closed their borders for the management of waste. So there's a lot of pressure now on national governments to really put in place sound and robust frameworks for the management of waste. Now, for me, this is excellent news, because then it is becoming a national priority, it is becoming a political priority, and governments are taking action, which hopefully will create this kind of movement and motivation for us to look at waste in a totally different way, post-COVID-19, hopefully.
Great. No, thanks for that, Ralph. I'm very conscious of time. We're now into the last sort of 20 minutes or so of our panel, and we still have a couple of very big questions to ask. And I'm going to turn to Donovan and Ruth on this, because there's been a lot of questions around, you know, just dealing with waste, or how can you reuse waste that's been composted or whatever. And I think this is getting into the lessons that we're needing to learn that will take us forward into a better space. You know, hopefully not just because of pandemics, but how do we, you know, look at waste management from a more opportunistic, perhaps, point of view? And that will move us on to our last question as well. So what are some of those really important lessons that we need to learn? And I think there are too many individual and, like I said, very specific questions that are on there. They're being answered and commented on by each other. And there's one intervention that I will take the opportunity to make as a moderator. On the UNEP website, there's the UNEP, the environmental responses to waste management, medical waste management, and there's a lot of really rich resources on there. So I'm trying to not multitask by type at the same time, but if you go to the UNEP website on COVID-19 responses, there are fact sheets, there's advice and guidelines on technologies to use. These were all created with UNEP in consultation with UNDP, with the ILO, with WHO, and a number of international NGOs. So there's lots of resources out there that will help answer very straightforward and common questions that are coming up about, you know, do I autoclave, do I not, and what do I do after I've autoclaved, whatever. So without going into, you know, the minutiae of individual detailed questions, please go to the resources. There's lots out there. And I'll turn to Donovan first, and then to Ruth, around looking at some of the key lessons that we need to take forward to sustain our learning and our actions to make sure that the next time a disaster of whatever proportion happens, we're better placed to deal with things like medical waste. So Donovan and Ruth.
Okay, I'm going to talk about a couple of crises, if that's okay. I mean, Frank's already mentioned the Ebola crisis and the efforts to put some autoclaves into place in West Africa. And that was, you know, a very brave attempt. I know the engineers that did it. And I think that the difficulty was that they were in the middle of a crisis in least developed countries. And so despite the huge efforts that they made, that was not as successful as it might have been. In contrast, we had some partner hospitals in Kathmandu in Nepal, where we had good, robust, locally appropriate waste treatment systems in place. We had good segregation. We had well-trained staff. We had biodigester for the organic waste, all the food and so on. We had autoclaving, and we had recycling. Then 5 years ago, almost the day, well, just 5 years and 1 month ago, there was the Gorka earthquake. 7.8 magnitude, and then 3 weeks later, a 7.3 magnitude. The hospitals where we had those systems in place coped. Beer Hospital, which was Kathmandu's largest trauma center, was dealing with 3 times the amount of waste that they normally did. But because the people that were dealing with it were well trained and proud of what they did, some of them didn't miss a single day. And so we know that if this system is in place before the crisis, it will handle it. And talking about the human side is so important. Kate already said these people are heroes. I utterly agree, and we actually managed to get them recognition from the Ministry of Health for the work that they did. So this is this is a key message. After this crisis is over, I mean, we mustn't, we've got to be careful about rushing to try and install systems during this crisis, because it will be very difficult. We have waste equipment that's been held up, it was already in transit when COVID struck, because now we've got, problems with importing and exporting and so on. So it will be extremely difficult to put new technologies in place now. But once the crisis is over, let us not forget the need to get this in place. Let us keep the priority up and make sure that we have robust systems in for the next time we end up in this situation. I also want to talk a little bit about the policy side, because the policy needs to address the human side as well, and monitoring and evaluation. So the policies must mean that there's a proper professional training and career path for the waste handlers. They're very often the least advantaged people. This is a job that they do because they don't have any other opportunities. But these are infection control professionals who are protecting our health, and they need to be trained and appreciated and paid that way. Then, how do we maintain the systems? There's not enough monitoring and evaluation in place. There are no penalties for people that fail. So this, one thing we're learning during COVID is to do more remote monitoring. Let's get that in place. That's a high-tech thing where we can help. And then when we're talking about the plastics, I have 3 words for the policymakers here: extended producer responsibility. We already have this in place in places like Europe for end-of-life vehicles and waste electronics. If a plastics manufacturer is making gloves and, by the million, they need to be contributing to the system to make sure that they're disposed of. If a donor or a supplier is sending equipment, they need to have in place waste management as part of that project. And anything you want to add to that, Jonathan?
Yeah, I think those comments are great, Ruth. I think that it's the crisis has really exposed weaknesses which were already there in many countries in the waste management system. I think it's just highlighted them. It's brought attention to them, as has been raised by some of the other speakers. And I think we must learn lessons from this, because we've really seen a really strong light shone on systems which already were failing, but now they're failing with consequences. And they're failing not only with consequences for the poorest and those most exposed, but the consequences of everybody living in that environment. And I think that that's a major lesson. It's also, on a positive side, highlighted systems which are working and systems which are being well invested in, which recognise their workers, which have in place an efficient infrastructure and have been able to adjust and to cope and to adapt. And I think that that's also a very important lesson. I think there are qualitative and quantitative aspects. I think that it's really exposed the need to recognise those that are working in solid waste management systems, particularly as we've talked about the informal sector and all of the different relationships and connectivities, reaching from people that pick at the household level to scavengers on dump sites and their vulnerabilities. But it's also helped us understand, I think, and recognise the incredibly important role that all workers in the waste system play to keep our environments healthy and safe. And I'm hoping that this pandemic really brings waste management out of the kind of shadows of discussions of something you just pay a bill for or somebody else takes care of, and people understand the centrality of waste management to a healthy household and a healthy environment and healthy city. I think there are short, medium, and long-term lessons to be drawn from it. Short and medium and long-term, I think, areas which need to be focused on. The short is just information. We need to get information out to those working in waste management, and it needs to be good information science-based information so the right decisions are made. And I think that that's the critical short term. The critical medium term is to learn from those lessons, to be able to have mechanisms by which we're able to identify what's worked and what's not, and to be able to look at the regulatory environment and the policy environment and address those issues. And I think the longer term need, which needs to start now, is that we need to start investing more effectively in our waste management systems. And that includes, in investing in sanitary landfills, in effective medical waste systems where they haven't been in place, but also investing in decentralized systems which are closer to people's households and which don't involve systems which are highly centralized and can easily break down in terms of a crisis. And that really feeds into the whole resilience angle, where if you have centralized systems, if you have a single unsanitary landfill 50 kilometers away, of course a crisis like this is going to really expose that infrastructure vulnerability. So I think we need to start really looking at infrastructure investment from development banks that have perhaps not been so interested in these sorts of areas, and really get them interested in investing in solid waste management for our future, for our future health as well. Thanks very much.
Great, thanks very much for those comments, Donovan, and also to Ruth as well. Those were really good, and I think they addressed a lot of those issues that we were talking about in terms of lessons learned. There's a lot that's coming out on the chat site as well, so I just want to send a big shout out of thank you to all the people who are providing advice and providing links again. So we really appreciate you. It's like having an extended panel, so we appreciate your interventions as well, silent as they may be from an audio point of view. We only have about 13 minutes left, if I'm looking at my clock correctly. And we have another question that was posed to us in terms of what the organizers wanted to get out of today. And it's a little bit perhaps off the beaten track of waste management, but it's one that has been touched upon in the chat box on a number of occasions. And that's this question around the real and safe opportunities for entrepreneurs and small businesses in sustainable medical waste management. We've been talking about the safety of it, the concern that we have about disposing medical waste properly, that there are many people around the world for whom dealing with waste in general, and now adding to that mix a different type of medical waste, it could impinge on their livelihood, and these are some of the poorest of the poor. So I'm going to perhaps go back to Kate and Frank on that from a WHO point of view in terms of the kind of guidelines and the sort of work that WHO is doing, perhaps at the community level with waste pickers and people who make their livelihood from waste management. And perhaps, Frank, you can talk a little bit toward what UNDP is doing or what you're knowledgeable about in terms of opportunities for small business. So with that, I'll leave it over to Kate and then to Frank, and then I'll wrap up at the end of this.
Sure. So, yeah, I think this is a super interesting one, and I think focusing on the fact that what we need to do really is to make sure that we have a continuity of existing services and build back better with more resilient services. There's a huge amount of opportunities for small businesses and entrepreneurs the whole way along the waste chain, whether it's from collection right through to treatment and reuse. I sort of wanted to put a word of caution in here though a little bit, because I think we need to be careful that small businesses and entrepreneurs don't take the opportunity to exploit fears around and provide services where they're not necessary. We've all been talking about how much there is to do. There's no shortage of things to do, so let's make sure it goes to the right place. To give you an example from other sectors, what we see a little bit in drinking water is sometimes some kind of misuse of evidence around cancer risks from disinfection byproducts, for example, being used as a way to sell people filters that may not work or that they don't necessarily need. And I think we want to be really careful not to encourage that type of entrepreneurship within this, but really to fill those gaps in the existing service chain. So, and we've been talking a lot about, about increasing the visibility of the need for waste management, mainstreaming it more in the overall health agenda. And I think if we're successful in doing that, we will see those incentives triggered from the kind of highest policy level to create the space for those entrepreneurs to move in. Because I think what we kind of know is a lot of waste businesses, they tend to operate on quite small margins, right? So I think it's really important that the right incentive structure gets set up at the highest level to kind of enable those types of businesses.
Great, thanks for that, Kate. And Frank.
Yes, thanks, Monica. UNDP has indeed been in all of its projects in Africa and all the other countries, taken a keen interest in helping the least privileged, those who basically are living on the margins, get involved in the recycling of waste, management of waste, the rag pickers and all the rest. This provides sustainable livelihoods. It's very important for many of the least able to afford decent living, and this is going to continue. What I would like to, however, say is that I think what Donovan had stressed, I had also stressed, the greatest challenge we have is preventing these single-use plastics from really polluting the environment, polluting the oceans, polluting landfills. There are already 4.9 million cases of COVID-19. I have no idea whether this number is going to double, triple. We have a second wave, a third wave. But if we do not go in with the durable plastics, which can be disinfected, reused several times, if we don't solve that problem, we're going to create a massive problem in the future with all the plastics in the environment, in the water, and elsewhere. So I think this is very important to also start now to prevent a future plastics explosion problem. Thank you.
Thanks for that, Frank. And I think we have a few minutes left, so perhaps I'll ask Ruth or Donovan if you want to perhaps give that some thoughts or some comments around entrepreneurialism and waste management, particularly from the sort of smaller entrepreneurial communities around the world.
Sure. I think the recycling thing is vital. You know, in the work that we've been doing in Nepal, we've managed to recycle a surprising amount of the plastics that come out of hospitals. Syringes, if they've had their needles cut off at the point of use and have been disinfected in an autoclave, those are worth 30 rupees a kilo. It's good quality plastic. And actually you can get from these, because they're institutions, you can actually get a quite good consistent waste stream in comparison with what comes out of the consumer waste stream. So that's something that really we could build on. And over years we've built up good relationships with the recyclers, and they started with a few pieces of waste and they've expanded as they've understood the value and the safety of the systems that have been going on. So we mustn't neglect that, and it is worrying that people have been told to stop recycling. I mean, the countries that have had some of the worst problems with waste during COVID are the places that have stopped segregating, because suddenly they've multiplied their waste amounts without giving themselves extra capacity, and we really must not do that. Other things that we need maintenance engineers, because keeping the equipment going is absolutely vital. When large-scale projects spend a couple of years in putting something in place and then they're not maintained afterwards, all of that is wasted. We need the cleaner themselves to be properly trained and put in place, and we need local experts. The projects where we're most successful is where we've got good local NGOs or other people that can do waste assessments, that can be independent monitors, that have the skills to build a biodigester that can cope with the placentas as well as food waste, and to act as independent auditors on these systems. So those are the people we're looking to at the national level, because those are the ones that, as an international expert, I can advise, but it's the local people that are absolutely essential to put these systems in place and make sure that they're maintained long term.
Great, thanks for that. And Donovan, perhaps from your side, and this is I think an area of small business that has existed for a long time, and it will exist but this has got a particular concern around it because of the concern for contamination for viruses. There's a lot of other bad stuff that happens in rubbish dumps as well. And maybe we want to touch on that and look at some advice that perhaps you could give to small businesses and entrepreneurs.
Well, I guess what I'd like to see is probably a greater support and innovation around both the supply and demand side. So I think that, there's a lot of opportunities for innovation in those supplying PPE materials, safety materials, masks, what have you. But I think that there's an important opportunity to support businesses in producing materials which have a less environmental impact. And I think that would be a really interesting and I think a very important thing to see happen from this, that there's a recognition that, well, the materials that are in play now are necessary, but we're smarter than that, right? We don't need to produce materials that we can't deal with anymore. We're much smarter than that, hopefully, as a human race, that we don't need to repeat the mistakes of the past. So I would like to see investment and innovations in materials which keep people safe, but which are also have a less environmental footprint or a greater circularity around them. Yeah. And the second part of that is just to support those collection businesses, those businesses that are already in the recycling industry, understand how they can attach value to these products, how they can recycle and reuse these products. So to again help the circularity from the demand side as well as the supply side. And I think that, as the world does open up at some point of the pandemic, when people travel and what have you, we're not going to see a diminishing of the dependence on personal safety materials and what have you. So we really need to get in place materials which have a much less environmental footprint, and we need to support those businesses that want to do things with these used materials in terms of economically viable businesses. Thank you.
Great, thanks for that, Donovan, and thanks, Ruth. I see that we've got about 2 minutes left on the clock, and I'm going to actually turn over to Rolf, both as the Executive Secretary for the Basel, Rotterdam, Stockholm Conventions, but also from his experience as being a former Minister of Environment and Energy from Seychelles, and having to deal with this at a very high level, at the policy level. So, Rolf, you've heard a lot of the discussion on the chat group and verbally as well. I'd like you to perhaps just give a closing remark from your side, and then I'll summarize the whole meeting. So over to you, Rolf, for a quick summary comment.
Thank you, Monica. I mean, the first one, and I've repeated it, I think 3-4 times, is political commitment. Ministries of Finance need to provide the resources for waste management at the national level. And I think I cannot overemphasize this so much, because many countries don't prioritize this as an important issue. Of course, it is linked to health, it is linked to the environment, it's linked to everything. And I mentioned other kinds of vector-borne diseases as well, which is prevalent in many countries because of poor waste management. There's been some really, really interesting suggestions. I've liked the suggestion from Ruth, from Nepal, recycling. I mean, people are scared of medical waste for obvious reasons, but there are systems in place, technology in place for us to deal with the bioactive parts of waste. And once we've dealt with the bioactive parts of waste, then the solutions for us to recycle those kinds of waste are endless. And I think a lot of this is an opportunity now for us to look at this and to create the awareness that as a hospital, you can get the actual support of not only grassroots, but the private sector, the community out there who I'm sure will build and develop a business out of it. And that will help us towards working towards a more sustainable approach to medical waste. Thank you.
Great, thanks very much for that, Rolf. And I think a good way to end off the discussion. So I think we just hit it under the wire. It's 4:30 on my computer clock. So I want to reach out to the panelists, to Kate and Frank and Donovan and Ruth, and to Rolf. And I'm going to include Richard Piper in there. He's been sort of our 7th panelist behind the screen, because he's done a fantastic job answering some of the questions, taking a little bit of pressure off of us with some very specific things, providing all kinds of resources. So a big shout out to you, to really appreciate it. And I just want to thank also the organizers for putting this together and bringing all of us together. There's been a really rich discussion. I'm so pleased with the kind of interaction we've had in the chat box. Lots of resources out there, and I hope we've given you some information that you can think about, that you can use right away. It will take you into the right direction to look for even more resources, and you know, the kind of people that you can reach out to for those of you who are participating in today's event. So without further ado, thank you again to the panelists. Thank you again to the organizers, and especially thank you to all of the participants for your richness in this whole discussion. And I wish you well for the rest of the day, wherever you are. Thank you.
Thanks, everyone. Thanks, Monica.
Bye.
Thanks for the questions, everyone.
Thanks, everyone.
Bye-bye.
Thanks. And thanks, Uta.
Bye-bye.